Good morning, everyone, and welcome to the ECA Coronavirus Webinar series. Today, your presenters are Paul Reeve, ECA's Director of CSR and Communications, and Paul Williams, HS&E Services Manager at ECA. Today's presentation is on managing site safety. This will include topics such as industry guidance, site operating procedures, risk assessments, and much more. The session will be followed by a Q&A. Joining us for the Q&A, we have Andrew Eldred, ECA's Director of Employment and Skills, and Rob Driscoll, ECA's Director of Legal and Commercial. They'll be on hand to answer any questions you may have relating to furlough or any other legal and employment topics. Just a little bit of housekeeping before I hand over to Paul Reeve. The Chrome web browser is the recommended browser for the best webinar experience. The Q&A box on the screen is where you'll be able to leave your questions. Feel free to post throughout the session, and our presenters will do their best to answer as many questions as they can at the end of the session. The session is being recorded, and the full replay will be available on ECA's YouTube channel in due course. Thank you everyone for joining, and over to you, Paul.
Thank you, Omar, and thanks to everybody for joining us this morning. If you could move to the next slide, Omar, that would be helpful. Thank you. So what we're going to talk about today is, very briefly, I'm going to give us some context by talking about the industry guidance and how the current coronavirus situation is being enforced on sites. And I'm very mindful that there's at least two different types of work environment we're talking about. There's building sites, if you like, but there's also maintenance and facilities management. We'll go into those things a bit later. I'll then need to say some things, I think, about the site operating procedures, which have been issued by the Construction Leadership Council, the CLC, and their hierarchy for close proximity working. And close proximity working will be a key feature of the webinar this morning. What we perceive from the feedback we've had from member companies in the ECA, but also the industry more widely, is that two very important issues are the Public Health England and CLC statements about the ability to work up to 15 minutes in close proximity, but also questions around the use of RPE and face masks. These things will be featured in this presentation this morning. We'll also have a look later at another key issue, which is travel. But I would like to give some context before we get to those points. The key role of ECA and BESA site guidance. ECA has worked with BESA very recently to issue two new sector guides in this area on the subjects of close proximity working and what we call special environments. It's actually a term used by Public Health England. What it really means is sites where it's known that there is an increased risk of coronavirus transmission. I'll talk about those, particularly the one on close proximity. The role of risk assessment, which is vital in all of this, we'll cover that. The use of RPE, travel to site, as I mentioned earlier. And then we'll have a look at the value of keeping records in all of this and touch on the issue of how to protect not just your workforce and to work efficiently as best we can in this very difficult situation, but also to help to protect yourself from any liability down the line. And then finally, representing our sector, representing the interests of our industry to the CLC, to Public Health England and other bodies. So that's what we're going to talk about today. Omar, if you could move to the next slide. So one thing I would like to say before I go through this slide is that virtually everything that we're dealing with at the moment is new. Even if we're experienced health and safety practitioners, or maybe not, all this is a new environment for us. What's going on at the moment? People are trying their best to understand the guidance. They're trying to work with this in the wider context of health and safety. So I think today we'll hopefully be able to give you some insights, maybe some answers to some of your questions, hopefully all of them. But please don't be surprised if we cannot give you the magic bullet answer to every single thing. But we're going to try, and we'll do our best to address the practicalities, what's possible, what's doable, and what works. But let's start just by talking about the background. Public Health England sets the national guidance for what's happening in the workplace, and that means all workplaces, not just construction and maintenance. It's well known what they're recommending has to happen. I'm not going to go through these things in detail. We all know about social distancing now, and we all know about the need and value of effective hand washing and not sharing items and cleaning surfaces. Those issues are well worked now, and I'm not going to spend our time this morning going on those, but it's really important to mention them because they are the linchpin of the preventative measures. And anything else I say today, whether it's about close proximity or anything else, always bear in mind that the first place to start is to avoid close proximity, do social distancing, do the hand washing, etc. That's so important. HSE is enforcing the PHE guidance. This is how it actually is meant to work from an enforcement point of view, using the Health and Safety at Work Act. So whether or not they're active out there, I'm not sure. We're not picking up an awful lot of knowledge that HSE is active in the field. They've said they're not going to be doing proactive inspection at the moment, but they are the enforcing body. But what they're looking at is the PHE guidance. And that means that we should be looking at the PHE guidance and anything that comes out of that. That's the actual bottom line for us, is that's the authoritative guidance on what to do. And then there's a thing called SOP version 3. That's the Site Operating Procedure. This has been issued by the Construction Leadership Council, and this takes the PHE guidance, which is in the public domain, and turns it into construction industry-wide high-level procedures. That includes reference to close proximity working, and it includes a thing called the hierarchy of measures, and it's that which I'll be talking about later. Okay, I'm on next slide, please. So CLC says for our industry, and this includes by, I don't know, by association really, facilities and maintenance work as well. But work on construction sites generally can be carried out, should only continue if it can be carried out in line with the PHE guidance, which I've referred to already, doesn't compromise wider health and safety, is done in accordance with the standard operating procedure, and workers can travel safely and responsibly to sites. Within that SOP version 3, as I said, there's this mention of being able to do face-to-face work for up to 15 minutes, and I'll explore that shortly. But when we go forward, we have to be mindful. If we're producing, for example, sector guidance, or when we're looking at our own procedures on site, does it align with the PHE guidance? If it doesn't, there's a real problem, because that is the authoritative enforceable guidance. Does it align with the SOP version 3? Whether or not we like it or like all the features of it, that is derived from that guidance. So it's very important to know what it says and to try and align with that wherever possible. Doesn't mean we can't question SOP version 3, and I'll talk about that right at the end. But right now, that's what we've got, and we need to look at it. It's very important. So they're the key things that would allow us to continue if we can meet those criteria there. If we can't meet those criteria there, we shouldn't be continuing to do work even on site, never mind close proximity working. Next slide, please, Omar. Okay, so SOP version 3 says, and I've slightly paraphrased it, but this is the meaning of it, I believe, and obviously we should all refer to the original guidance. Where not possible to follow social distancing guidelines in full, consider whether the activity needs to continue for the site to continue to operate. That's a mouthful, isn't it? Basically, it's talking about, is what you're doing essential for your site, for your task, for your project? And I know that, as always, people then say, what does essential work mean? Well, I think we've all got in our mind examples of what we know is essential work. I imagine keeping a hospital running and things like that straight away come to mind. And it's not just hospitals, could be something essential like prison premises or other types of premises. But then it becomes a bit grey and woolly, and at that stage, basically essential can also mean, I imagine, things which are on the critical path to a construction project. In other words, no further project work can continue until a certain activity is carried out, etc. But they are areas which are not defined. I wouldn't seek to define them, and we basically have to do our best, noting that sometimes we're not always in charge of what's going on site. It's other people who are making the site decisions, and the role of engineering contractors then becomes to discuss with those people whether or not the engineering contractor wants to continue in that situation or not. So it's not always our decision what actually happens, clearly, but whatever decisions are made about what is essential and what needs to continue for the site to continue to operate, which is what the wording is, that has to be a justifiable decision. There has to be a rationale for that decision. It has to look like it was essential, clearly. And if you can't realistically say it's essential, then the idea that you don't follow the social distancing guidelines is just wrong. So close proximity working, and I need to emphasize this all the way through this webinar, is meant to be exceptional. It's not meant to be the norm. So when we talk about the fact that you can do it, we're not saying you can do it all the time. We're saying that it's something that you really do as a last resort. But the SOP says when it's not possible to follow those social distancing guidelines of 2 meters, consider whether the activity needs to continue for the site to operate. If so, if you believe that what you're doing is essential for the work going forward, continuing for the site to operate, take all mitigating actions possible. That's what it says. So what we're going to explore in this webinar is what are those mitigating actions? And that's to reduce, obviously, the risk of transmission of coronavirus. The SOP is clearly based on social distancing and thorough hygiene and cleansing measures, but it does include a hierarchy of control that enables you to consider how you would do close proximity working if that's essential. Okay, next slide, please, Emma. Okay, so, and all this is following the CLC SOP guidelines, and I don't try to reinterpret what they're saying. What I try and do, with my colleagues in BISA and elsewhere, is we try and amplify on what they're saying so that it means a little bit more, or a lot more, hopefully, in the context of engineering services contractors. Okay, so you've worked out that what you need to do is essential for the site to continue to operate. Having properly considered all the options, if close proximity work is unavoidable, then it's risk assessment time. And risk assessment is absolutely fundamental to what's going forward. It's as essential as any other health and safety consideration. If anyone struggles with risk assessment on site, then they're going to struggle with this. So I'm going to go on the assumption that what we've got here is an audience that knows the value of risk assessment and how it's applied on site to control every day, if you like, health and safety issues. And this is an additional exceptional issue, which, as I've said before, is new, it's different. It's so different that, for example, HSE hasn't issued any guidance in this area. It's leaving it all to Public Health England. But risk assessment can and will help you to get through this, and I'll be talking about that as we go. So you need to, if you've come to the conclusion that everything's essential, you've got to do it, and that the only option you've got is close proximity working to get that done, and you've explored all the other options, then it's risk assessment, and you apply the SOP hierarchy of controls, which is in the CLC version 3 guidance. And that includes reduce the risk through minimizing the frequency and the time of workers being together. Isolate, for example, and these are all examples, by maintaining small teams who stay in small teams, so that if in the unfortunate event of any transmission occurs, it doesn't transfer to the wider working pool, either in your own company or elsewhere. And then here's the key one, I think, for many people, control. It talks about face-to-face working, which is a thing that needs to be avoided wherever possible. But if it is essential that that is what is required, then the guidance says keep this to 15 minutes or less where possible. I think a lot of people have a lot of problems with that statement, but that is the statement, and that's come from PHE guidance. Now, the PHE guidance seems to have derived from clinical settings to do with healthcare and what have you. It doesn't necessarily relate very well at all to site operations, but that's what it says. So we need to try and work with that in a practical way, and I'll explore that in a moment. Other things you can do, though, so we shouldn't just focus on 15 minutes as a single thing. This is a hierarchy of measures, and we should use them all where they work to reduce risk. So this is not an exclusive list. You don't just do reduce, or do isolate, you might need to do several of these things mixed up to reduce the risk to an insignificant level. The other things you can do under control, though, are consider a permit system, so that the whole process of working in close proximity is reviewed up front with a permit. Everybody knows what they're supposed to do. It's all been properly communicated. And the other thing you can do is to supervise it well or monitor it well. Some people have suggested on certain sites you should have almost like a coronavirus measures monitor person who one of their key roles is to look for compliance with social distancing and proper methods of work for close proximity working. Underlining again that close proximity is meant to be exceptional. It's not a new norm. It's not, no one's saying that you do that all the time. We're still not there. The last thing in the hierarchy is the use of personal protective equipment and respiratory protective equipment, and we know that that's a key area of question. I'm going to talk about that again in a moment as well. But be advised, RPE might be the last control hierarchy in the list, in the CLC list, but it doesn't mean it can't be used. It can be used based on risk assessment. Now, with all those options available, reduce, I mean, the first one is eliminate close working. But if you can't, reduce, isolate, control, use RPE. That's a hierarchy. You start from the top, you work down, but no one's saying you can only choose one out of those four. You could choose as many as you need based on risk assessment to protect your workforce. And that's a very important point. And I think a lot of people have perceived that RPE is being, how can I put it, sidelined, and that we should just not work with any protection for under 15 minutes, you know, because that's what it says under the control measure. That's not so. Do a risk assessment. Talk to your operatives. Obviously, I realise that some of the dynamics here might involve a main contractor telling you to do certain things in a certain way. That's a whole issue all of its own. But where you have a level of control with looking after your own people, and if you feel they're not being controlled, well, you know, the options are very difficult, but it might involve, you know, not carrying on. If the provisions of the CLC SOP version 3 can't be met, no one should be telling you to carry on. So let's be clear on that. But if you can carry on, then if you feel RPE is needed, and we'll talk about what types possibly that might be, then that's what you do. Do not choose RPE for everyday work where you are socially distanced. There's no need for it. PHE doesn't recommend it. No one I've seen recommends it at all. The CLC says don't do it. And the other thing is that there is an overarching concern within the industry that, if you like, the wanton use of RPE would unfortunately divert useful RPE from the health service. However, when in close proximity working, which we've underlined is exceptional, and based on all the things I've said, if you think RPE is needed, then that's what you specify to protect your people. I'm sure you'd all agree that protecting our people is the priority for us. So next slide, please, Emma. Okay, so we've issued sector guides on close proximity work and work in special environments. As I said before, special environments means areas where it's been identified that there's a risk, an elevated risk. It might be, you know, working in a healthcare related setting or something like that. We've issued a guide with BESL on that. It's called GN1. It's freely available, and there's a link at the end. The close proximity guide is GN2. However, and you can see it in red there, explore every available option possible before deploying anyone in close proximity tasks. And that's a message to main contractors as well. Have they explored every available option before they're asking or telling anybody to do close proximity work? Following a risk assessment, this is in our guidance, but this is based on the CLC and that's based on the PHE guidance. Following a risk assessment, RPE and other non-clinical fluid resistant face protection may be selected with other PPE such as overalls and what have you to further reduce the risk from close proximity work. The point there about further reduce is that before you do this, you will have looked at the other measures in the CLC hierarchy and you will have implemented as many as you feel are necessary to enable safe working in the coronavirus context. Bear in mind, of course, if there's an overarching hazard anyway, maybe there's a dust hazard around, maybe there's some other health and safety hazard, you will specify the RPE that you need to deal with that hazard. If you have a dust hazard that requires you to specify and use FFP3 tight fitting masks, for example, that will also give some protection against coronavirus anyway, provided it's face fit tested, people are wearing it properly. There are, as you probably know, and we won't go into it in great detail here, but there are many limitations to using RPE. They're based around the fact that it can modify people's behaviour when they're wearing it. They get the Superman complex, they suddenly forget to hand wash. They start doing things in close proximity they don't need to. And also there's the issue of cleanliness and hygiene around the use of RPE anyway, and its disposal. These are all issues you have to consider within your risk assessment. But even so, if you want to, if you have to specify it anyway for other hazards, then you're obviously going to get some protection there in relation to coronavirus anyway. But RPE can be selected as part of all mitigating actions possible, which is what the CLC says. So they are part of your armoury if you need to use it. And of course, if the client or the main contractor is telling you to use it, if that's what they're telling you, then that's pretty powerful stuff. And in many situations, particularly working in special environments, you'll find probably that the client or the main contractor is telling you to wear these things anyway, even before you've done your risk assessment. In terms of the RPE itself, it's really not for me here to try and say what RPE you should use, but what RPE you could use will obviously depend on your risk assessment, but it's very likely that you would be thinking about FFP3 or even FFP2 face fit tested masks. They would be useful. They will protect, they will give some protection against inhalation, of course, when they're properly fitted, and of course exhalation risk. There's the two types of risk here, is obviously the stuff you can catch from other people if they've got it, coronavirus, and of what you could breathe out if you had it. And you may be on site as an operative with coronavirus and you don't have symptoms. That's the problem. The symptoms arrive sometimes maybe 7 days before you, the actual virus arrives about 7 days before you pick up symptoms. So there will be some people on sites, presumably, who have coronavirus. I'd say only, I don't know how many, but it won't be everyone, certainly. But there could be some people and they won't show symptoms for a week. If you're wearing a mask of any respectable type, it will reduce the exhalation risk of you giving it to other people. But the other types of masks beyond face-fitted masks don't give you inhalation protection at all. They're not for that. So if you felt for some reason that you wanted to try and use other masks which weren't face-fit tested masks, they could provide some exhalation protection, but they won't provide inhalation protection for those people. And no one at the moment, PHE included, is saying use masks for exhalation protection on work sites. Not to my knowledge anyway, and I don't believe that's happened. Whether we're going there, we'll find out. But what I'm getting at, I suppose, is that there are options here. There are options, clearly control options for reducing the risk of close proximity work, and there are RPE options available to you based on risk assessment. Okay, Omar, next please. I should add, I think one of the reasons that PHE hasn't gone wild about using masks everywhere is because they are worried that they will modify people's behaviour. I don't just mean the public, I mean on work sites as well. They probably will modify certain types of behaviour in terms of cleanliness, and they do deliver their own cleanliness issues, about touching the mask and then it gets contaminated and you've got to take it off and put it on. There's wearability issues. We all know that masks aren't fantastic to wear all day. Sometimes you have to change them during the day. It does bring complications, but these are just things worth bearing in mind. Okay, we've got the next slide. So what I'm going to do now, everybody, is my pleasure to pass over to Paul Williams, my colleague at ECA, who's going to talk to you a little bit more about the value and use of site-specific risk assessment and ERAMs. Thank you, Paul.
Thank you, Paul. Yes, indeed. I think, of course, risk assessment is the backbone of health and safety, and we need to remember that it should always be site specific, so site or workplace specific. And some of the key factors when you're thinking about COVID risk assessment are the workplace capacity, so the numbers on the site to achieve social distancing. I think that's particularly key. Layout considerations, and you'll have seen in the SOP and other documents about one-way systems. So anything that helps reduce the risk of the contact in terms of making sure that you keep that proximity. And the third area, of course, is cross-contamination, and you will have heard about hand washing, cleaning, hygiene and disinfection, and they're all elements of that site-specific control to reduce risk. And as Paul said, GN2 states in terms of close proximity working about elimination. Can you avoid it? Do you have to do it? And that it should very much be the exception rather than an agreed way of working. And the other elements of that in terms of consideration for your risk assessment to write down and put into the assessment are the frequency and time of the close proximity, the number of workers, making sure it's as short as possible, certainly less than 15 minutes that operatives face away from each other if they can. And I think one of the really best practical ways to look at this is to plan and think about the work sequence of events, break it down, even rehearse it in a safe way to see, well, how can you achieve minimum close proximity working. The idea of isolation, so making this idea of cohorting where you keep teams together to make sure that you not only just through the close proximity work, but for the rest of the day on the site if you can, including travel even as well. And then, as Paul said, about control and making sure that considering permit and authorization processes and that kind of thing. Supervision and not forgetting at all what runs through that, of course, is this whole personal hygiene and biocidal cleaning piece. What we've done to help with that at ECA is we've used the ERAMS tool for those of you that are familiar with it. So we've introduced a COVID-19 hazard, and there are two within the tool. One's for general working, which would be suitable for example, if you're possibly working in someone's home, that sort of thing. And then specifically if there's close contact working. So you can find those under the biological agents hazard, so in the hazards drop down menu, and the indicative control measures have been added to, as I say, to the general site situations, and also then there's a separate one that you can select for 2 meter distancing, and you can put those in your settings. If you put your settings to autofill, it will auto populate the controls for you. But I think to sum up for this slide, I would say that that do the risk assessment and crack on. If you can't do a suitable and sufficient risk assessment, then you shouldn't be doing the work, I think, in summary, I'd say. Can we move to the next slide, please, Emma? Thank you. So thinking now specifically about travelling to and from site. So public transport, again, this has been in the national press and in the public domain discussion around this. And of course, the degree of risk in public transport is dependent on a lot of things, but the key thing is density of the passenger population. So I think it's important that we look at scheduling time and start and finish times to avoid peaks. I think that really helps show shift patterns and that kind of things to try and avoid large crowds. But then also, if you're walking, try and plan your route in terms of avoiding large groups of people, crossings and that sort of thing, so that you're avoiding major conglomerations of people, if you like. And as it says there, that making sure you don't wear your overclothing and PPE, so there's a risk of contamination on the public transport that you're taking that to site with you, and considering the use of non-clinical masks of face covering. help reduce risk in terms of spread. Moving to thinking about vehicles, it's certainly true that we shouldn't be looking to share vehicles if at all possible. I know sometimes that isn't particularly practicable, but if you can travel on your own in the vehicle, that's obviously going to be the best way to deal with it. Otherwise, the same rules apply, really, the same ideas in terms of reducing risk apply as with the others. So that around cleaning, around cohorting, so the same people work together and travel together, thinking about parking so that you park in a place that minimizes your mingling with other people and parking is available near to the site. There has been talk about in-cab partitions, of course, which it's a possibility, but of course, what you don't want it to do is interfere with safety in terms of driving, in terms of visibility, compromising your insurance and that kind of thing. So, for example, plastic beading and the type and that sort of thing has been suggested, and of course obvious issues like having breakdown cover and checking your oil and water and that sort of thing to make sure that you're reducing the risk of breakdown. Although the AAA and the like, I understand, do have systems in place to deal with that. Those were the main points that I wanted to cover on the transport side of things. So, Omar, if you could hand over to the next slide, please.
Thanks, Omar. Thank you, Paul, for that. And I just want to head towards the end now, talk about basically the value of keeping records of what you've done. So whatever's going on site in terms of your precautionary measures and your risk assessments, do keep a record. Keep a record of your risk assessments. Obviously, you can do that in ERAMs if you use ERAMs, but of course, more generally, that's good advice. Keep a record of your safe systems of work. Keep a record of anything you've done to communicate these things with and to your team, your supervisors, your operatives, and what have you. If you're involved in, i.e. generating a construction phase plan or a recipient of a construction phase plan, keep a note of it. If you're drawing it up as the main contractor on site, maybe you're doing FM work or something, certainly keep a record. And as I said, in terms of communication, I mean, ECA produces an example toolbox talk on coronavirus protection on the ECA Coronavirus web page, which I'll reference in the next slide. But records really important as a means of showing what you have done. Take photos of good practice if you need to. Use them as visual site standards to illustrate to other people what you want to happen. This is also good stuff in terms of records. It shows you've communicated to people, which is a requirement, as we know, of good health and safety practice. It shows you've taken reasonable preventative measures. And that will, of course, will serve to prevent exposure of your workforce, which is priority 1 and priority 2 as well. But if you come around to another priority, it would help you to be more protected against any questioning of what you've done later down the line. HSE, may or may not get involved in something where you might be a subcontractor. You need to be able to show what you've done. And also in terms of civil liability, if any claims came in from anybody about anything, it really is a phenomenal help if you've got evidence of taking reasonably practicable measures. Conversely, if you don't have records of what you've done, even if what you've done is brilliant, you've got no evidence that you took reasonably practicable measures, and then you're in defensive mode from day one. So I think very important practical advice there going forward. And you can look at the CLC guidance and use that as your reference point for what good is supposed to look like. And hopefully the ECA and BISA guidance, I'm sure, will give you more insight into what you can practically do on site. But these ECA BISA notes, they're guidance notes. They're not there to tell you what to do, but they are there to help you decide what to do. But it is your decision based on risk assessment. Okay, next slide, please, Omar. Okay, and finally, and I'm very grateful to everybody who's joined us at the webinar today, and I'm looking forward to your questions. And if we can't answer any today, obviously we'll pick up on them and try and answer them in some way later on as well. But just to conclude, all of our coronavirus safety information is freely available. Many reputable bodies, have done this. They decided that this is an emergency situation. It's fantastic, to be able to help members with these things, but ultimately, right now, we believe it's really important to help the whole industry, to do the best things available. So everything's freely available on the website. That's the hyperlink there at the top. And in addition, we continue to represent the interests of the industry, and particularly our members, to all the key bodies to help improve what's out there in terms of policy and guidance. I think most people would agree that what's out there needs to be improved. There's a lack of clarity in some key areas. We have to follow what the guidance says right now, the official guidance. We should really follow that. That's the best available guidance and advice on what to do. Public Health England have got plenty to think about, we all know that. And we can go to them and say, look, can you please clarify in these areas? But the clarification may not be quick, or it may not even come at all. So we have to just understand what they're saying to us. They are the experts. And even if we don't agree, we should follow what they say, but we are allowed to question what they say and ask for clarification. And we're certainly regularly going back to PHE through Build UK, which is an industry umbrella body, through various other groups, CLC, Construction Leadership Council, asking for better clarification on what 15 minutes practically should mean on a work site in construction and maintenance. Whether and when to wear RPE, and I hope in this presentation we've given you some fair understanding that using RPE is an option available to you based on risk assessment. Don't let anybody tell you it isn't an option for you if that's what it takes, but don't use it when you're socially distanced. There's no need. And travel. What about social distancing when that's unrealistic? What can we do there to improve basic industry guidance on travel? Some of these things may come in the weeks to come, and the government may change its own policy on the use of RPE in the public, and we wait to see. We also welcome your feedback at all times of what works, what's actually working out there, what are you doing that helps and works, and on site and travel matters generally, whether it's a problem or solution. We would love to hear from you. Okay, so that's the end of the webinar presentation. The ECA and BESA guides, which are free to all as well, are available on the BESA website, but they're also available on the ECA website at eca.co.uk/coronavirus. And over to you, Omar. Thank you.
Thank you very much, Paul, and thanks to both our presenters, Paul Reeve and Paul Williams, for the presentation. We hope you found it useful. Certainly some much needed clarity on some very complex topics. So thank you again, both. We've got a few questions, but before we dive into those, I'd like to just bring in Rob and Andrew. Are there any recent developments from the last couple of days on employment and legal topics that it would be important for viewers to be aware of, because it's such a fast-moving space? And where can viewers find the best resources to get up to date?
Can I answer this first? The easy answer to that question is on our website. So what we've done is, as we've said on previous webinars, is try to make sure that all of our information on each government announcement or change to any of the schemes is updated. So we take down information, we reload it onto the website with the right current correct position or links through to the government system. From my point of view, this week has involved updating the government's announcements document, which is the kind of plethora of support they've put out there. But the major key development has been a standalone guidance note which covers the self-employment support system, together with updating the loans document, which is also downloadable, which covers the scape of the financial landscape, right from small business grants through to hardship loans in local authorities, bounce back loans up to 50 grand, 0 to 5 million in the the coronavirus business interruptions loan scheme, and then the large business loans before you get up to the Bank of England equity lending system. So that's me.
Okay, on the employment side, I would say principally what we've been doing this week is preparing for next week, which we believe, the momentum behind a return to work is clearly building, and so we're preparing for that. Obviously, on the policy side, one of the big questions is what's going to happen to the furlough scheme and what might take its place. And ECA has been very active, both within CLC and elsewhere, arguing that something does need to take its place. And indeed, furlough or something like furlough needs to continue for certain people, and specifically, of course, people who are vulnerable, people who are having to shield. So that's sort of the policy side. In terms of the issues that we're starting to get, obviously a return to work starts to raise employment issues about people who aren't happy about returning to work. What do you do with people who aren't happy and are fearful? So I'm not necessarily going to answer that now because there are lots of different circumstances that can arise, but those are the sorts of things which I think are likely to become more to the forefront now as we move from a period of lockdown to a period of slow and not necessarily always steady reopening.
Thank you very much, Andrew, and thank you, Rob. There will be more on these topics that ECA will be providing for members and the wider industry. Keep an eye out for email notifications, and do frequently check back to our website, eca.co.uk/coronavirus. It's updated on a daily basis with all the up-to-date information you need. So let's dive into some of the questions we've had on the presentation. From Annette Thompson. Is there any guidance about operatives working away from home and sharing accommodation? Paul, Reeve or Williams?
I'll come in on that one. I think that I'm not sure that it should even be happening, to be honest with you. That's not very sort of helpful if people are actually trying to do it. It would take a heck of a risk assessment. The idea of sharing other accommodation with people when we've all been told to stay at home as part of the key measures to prevent the spread of coronavirus. I'd need more advice and information on that one, but the first reaction is that it doesn't sound like a thing that people should even be doing, not when we're even worried about how people travel together. The idea of sharing accommodation with strangers and stuff, if that's what the question is asking. I'm not criticising, I'm just saying I think that's a very, very tough question to give a helpful answer to at this moment.
I think, yeah, well, to add to that, I think it was one of the areas that was banned temporarily by the government in terms of close down of non-essential businesses. I think there were some exceptions to that, but yeah, I agree with you, Paul. I think it would be very tricky to think about how you could maintain social distancing and the like. So that it may well be that when the easing begins, and I think the Prime Minister is going to do a presentation on Sunday, there might be some talk about how those sorts of things might start to evolve.
Can I just come in on that as well? It's important to note that Paul is absolutely correct. When lockdown happened, all hospitality, including caravan parks and anywhere else, was asked to shut immediately. There was no exception to that. So the first thing that hit construction as an industry, when it was told to carry on, was a lack of accommodation. Subsequent to that, we have on our website, or certainly in our e-bulletins, put links through to the Build UK address or postcode accommodation finder initiative, so that if you do have to go down this road, and this is separate to what Paul Reeve and Paul Williams are talking about, which is actually managing the health and safety risk, you can at least find accommodation for your operatives and then think about how you manage the risk thereafter.
Just to chip in, to complete the set, just thinking about the employee relations issues of people sharing accommodation. Do you really want to get employees complaining that the others are breaching social distancing and all the rest of it? I suspect you're going to end up with a lot of complaints. So for that reason, it's not the main reason, but for that reason as well, it doesn't sound to me a very good idea.
Thanks, everyone. We have a question from, it's anonymous. Having previously identified occupied properties that require rewiring, can works be carried out providing that neither the occupiers or the operative have any health concerns, and work is carried out in accordance with social distancing guidance and appropriate RAMs?
Yeah, I would say the answer to that is yes, bearing in mind the conversation we had about the controls that one has in place. I would add that ECA has produced a really good video on tradespeople working in the home with some really good, so a very short video with some good information about this and other things around not making sure as well that you're bringing the virus into someone's home, so making sure that you observe hygiene, cleaning tools before and after, and that sorts of things. So I think it certainly can carry on, but provided that you have those risk assessment controls in place.
Yeah, I think, you know, for all construction and commercial and even domestic work, as long as we follow the guidelines and we do our risk assessments, I think everyone's encouraging us to go out to work safely where people cannot work from home. And obviously that job that's described there is something that someone can't do from home. So I don't think there's any inherent problem with going to do that sort of work, as long as we follow the guidelines, do our risk assessments and protect not just the employees, but the people with whom they're associating, hopefully you'd expect socially distanced.
We've had a quite a similar question, also anonymous, just on EICRs, asking if EICRs can be carried out, providing the guidelines are stuck to. Might be worth clarifying on that point.
To be honest with you, I'd rather go back to our technical team to understand the nature of that question. So if the person who's asking the question, if we can somehow get the answer back to them later, I'll try to do that. But I'd rather refer that to the technical team, who've probably considered this in detail.
I think the point really that these questions are raising is there are different tasks depending on what kind of contractor you are, which kind of market you work with, whether you're consumer, public sector, commercial, industrial, infrastructure. It depends on the task. Reeve and Paul Williams have pointed out that we've got to contextualise the risk. From my perspective as the legal overview, there is a download about the, if you like, Paul, Reeve and I put it together on the legal requirements of employers. It covers the framework, Health and Safety Work Act and CDM and other things, and corporate manslaughter and everything else. The reality is it all comes back to everything Paul Reeve and Paul Williams have talked about in terms of auditable evidence trails, that you have thought about it, put in place policies, procedures and policed them, not just walked away, which was interesting that was mentioned earlier, having a person within the company who's a bit like the police person that goes around and checks that everybody's following the COVID-19 risk mitigation measures. And I think that includes domestics. There's some comments in the chat thread about domestic. I know I've watched building work going on next door to my home during this lockdown period and had 2 contractors into our house. I think on the consumer side, from the inquiries we've dealt with, it is more about perception. So the consumer wants to feel safe. So whether masks make a difference or not, or gloves or anything else like that, having a young family in the house, in our context, me being the consumer, we felt safe because the two contractors that had to come in, warned me and walked me through all the appropriate measures they were going to take and were going to ask us to take in that process. And therefore, we felt comfortable with having them in. That allowed their business to continue and their cash to flow and everything else that went with it.
Great, thank you, Rob and Paul, for your answers there. I think that broadly covers the questions we've received. I don't know if there are any other points you'd like to address before we wrap up and close out the webinar.
I think just one, Omar, just a plug, as we talked about in the webinar, for ERAMs. So within ERAMs, we have actually specifically put in COVID hazard and controls. So that's a good starting point for people to answer any of those the questions where they want to carry on work, be it in a domestic or a business setting.
Just
Yep.
two quick ones from me, Omar, very quick. In terms of working in people's homes, that, in domestic environments, if you go to our coronavirus webpage, there is template information there which outlines what you as a contractor can do to reduce the risk, and also talks to, if you like, the consumer themselves and gives them an expectation of what they're supposed to do and what you are going to do when you turn up to do the work. And that is supported by a short video animation, which is also on that, which you could send around to your domestic customers and what have you if you want to. And then the other thing was a very quick one, final one from me. There was a question on the chat there about asking what happens if people have had coronavirus, broadly speaking, what happens in terms of them coming back on site and what have you. The issues around that right now are that there's although there are reliable tests to see whether you have coronavirus or not, there are no currently reliable tests to say that you've had it. And those tests normally look for antibodies, and the antibody tests currently, although they were okay in the lab, as rolled out, there's no commercially validated UK antibody test right now. The reason I say that is not because I'm trying to get all scientific, it's just that people would love to be able to present a certificate and say, look, I've had coronavirus, I'm immune. That's not possible right now. There's nothing that allows you to do that right now, and it will take a bit of time before we can get to that situation. Thanks, Omar.
Thank you, Paul. And thanks once again, everyone. Thanks to all our presenters for joining us today, and thanks to all the attendees. As mentioned at the top of the webinar, full replay will be available on our YouTube channel at youtube.com/ECA Live. All our guidance is also accessible at eca.co.uk/coronavirus. Thank you, everyone, and hope you have a wonderful day. The weather's looking pretty good out there, and see you next time.